is made of a delicate layer of cells with a layer of protective mucus. This lining is strong, and in most cases, acid inside the stomach does not hurt it. When this lining gets red and swollen or inflamed, it is known as gastritis. Gastritis is a group of conditions with one thing in common: inflammation of the lining of the stomach. Gastritis may occur suddenly, known as acute gastritis, or develop slowly over time, which is called chronic gastritis. For most people, gastritis isn't serious, and it improves quickly with treatment. Rarely, however, it may lead to complications. There are several symptoms you may experience if you have gastritis. You may get a burning type of pain in the upper part of your abdomen. This may be related to meals. You may also develop nausea or vomiting. You may get a feeling of fullness in the upper part of your abdomen after eating. Gastritis doesn't always cause symptoms. You may therefore be completely asymptomatic even though you have gastritis. Occasional indigestion and stomach irritation are quite common. If you develop any of the following features, you need to meet a doctor soon. Persisting pain that lasts more than a week. Vomiting blood. Passing dark or bloody stool. Loss of appetite. Loss of weight. Or if the symptoms were related to a change in your medicine. The word gastritis means there is an inflammation of the stomach lining. There are a number of factors that protect this lining from the acid inside the stomach. There is a layer of mucus on the surface. This layer also has chemicals that can neutralize acid. There are special characteristics in the cells of the stomach lining itself. Weakness or injury to this mucus-lined barrier will allow the acid inside the stomach to damage the stomach lining. There are many conditions that can tilt this balance. An infection of the stomach lining with a bacteria known as Helicobacter pylori is the commonest cause of gastritis. Infection with Helicobacter pylori is one of the commonest infections worldwide. Only some people, however, with the infection develop gastritis. This may be affected by other factors like your diet and smoking. If you regularly use painkillers like Diclofenac or Ibuprofen or Aspirin, these may predispose you to gastritis. This is because they interfere with the production of factors that protect the stomach lining. Alcohol can irritate and damage your stomach lining. This makes it more vulnerable to the acid inside the stomach. Some people find that spicy food precipitate their gastritis. Smoking is strongly associated with gastritis. stress can also make you more susceptible to gastritis. Older individuals have an increased risk of gastritis due to a number of reasons. There are some rare causes of gastritis as well. Sometimes your immune cells can attack the cells in the stomach. This is known as autoimmune gastritis. Gastritis can also be associated with other diseases like Crohn's disease, AIDS, and certain parasitic infections. Rarely, a cancer in the stomach can mimic the symptoms of gastritis. If your doctor suspects that your symptoms are due to gastritis, he may perform some investigations to confirm this. You will need an upper GI endoscopy, also known as an esophago-gastroduodenoscopy. As the name suggests, this test uses an endoscope to look at the inside of the esophagus, stomach, and the duodenum. They will look for any changes in the stomach lining and for any damage known as ulcers. They will also take biopsies to test for Helicobacter pylori. Biopsies also help to exclude cancer. If you would like to know more about this test, you can see the video in the link given. If the doctor suspects an infection with Helicobacter pylori, he will do tests to confirm this or exclude this. There are many ways of doing this. The common ones include testing biopsies from the stomach lining or a breath test using a special device. Other options include blood or stool testing. The doctor will also perform some blood investigations. A full blood count will check the hemoglobin level. If you have ulcers in the stomach, they can bleed and cause a low hemoglobin. There are several treatment options to treat gastritis. The aims of treatment include both treating the cause and controlling the symptoms. The treatment you receive will depend on a number of factors, including your symptoms, their severity, your age, and your general health status. The majority of patients will be given medicine to reduce the stomach acid. This will ease your symptoms and help heal your stomach lining. If your gastritis was caused by Helicobacter pylori, you will need medicine to cure this infection. This is known as triple therapy because it combines 2 antibiotics and a medicine to reduce the acid. You will need to take this for 1 to 2 weeks. If your gastritis was caused by medicine like aspirin or diclofenac, you should stop these drugs if possible. The doctor may give you an alternative drug if you develop gastritis with these. If this is not possible, you need to take medicine to reduce the acid in the stomach to prevent these drugs causing gastritis. There are several groups of drugs that reduce the acid in the stomach. They act by either neutralizing the acid already in the stomach or reducing the acid production of the stomach. Medicine commonly used to reduce the acid secretion include ranitidine, omeprazole, and pantoprazole. There are a few things you can do to reduce your chances of getting gastritis. If you notice that certain food or spices precipitate your gastritis, you will need to avoid them. If your symptoms get worse when you skip meals, you need to ensure you have regular meals. Avoiding alcohol and smoking will also help prevent gastritis. If you notice your gastritis is brought on by stress, you will need to focus on stress management. If the use of certain drugs precipitate your gastritis, you need to talk to your doctor and change those medicines. In most people, gastritis settles in a few days and doesn't cause complications. Some people, however, may develop ulcers in the stomach. These ulcers can also give rise to bleeding. This may cause you to vomit blood or pass bloody or dark stool. If this goes on for a long period, you may become anemic. Rarely, if the gastritis goes on for a long time, it may increase your risk of developing cancer. So if your symptoms don't improve with medicine, you need to tell your doctor so that he can investigate you further. If you would like to know more about this or have any questions, please leave a comment below. You could also comment on any topics you would like me to cover in the future. Thank you.